Good morning, all. Welcome to the 2019 U.S. Financial Health Pulse webinar. We're so thrilled that you could be with us here today. My name is Thea Guerin. I lead the U.S. Financial Health Pulse Research Initiative, and I'll be your host for today's discussion. And we'll begin the discussion with a brief welcome and introduction. I'll then spend a few minutes providing you with an overview of the initiative. Then I'll turn to the key findings from the 2019 Trends Report, and I'll leave about 10 or 15 minutes at the end for your audience questions. Feel free, though, to submit those questions as I'm speaking via the panel on the right side of your screen. And I'll conclude with a few ways that you can continue to engage with this initiative moving forward. And a recording of the presentation will indeed be made available after the webinar. Before I begin the webinar, I'd like to extend a warm thank you to our funders and partners, without whom this initiative would not be possible. We are extremely grateful for the support of Flourish, a venture of the Omidyar Group, and the founding partner of the U.S. Financial Health Pulse. We are also grateful for the support of MetLife Foundation, founding sponsor of the Financial Health Network's Financial Health Work. And we're extremely grateful as well for the support of AARP, who in addition to sponsoring the overall initiative, has sponsored some additional reports on the financial lives of older Americans that's based on this data set. We're also thrilled to be partnering with the University of Southern California's Center for Economic and Social Research to field the study to their online panel, the Understanding America study. And we're excited to be working with engineers and data analysts at Plaid, a data aggregator, to collect and analyze transactional and account data from study participants who authorize it. And I'd like to begin this conversation by asking all of you to think about the economic headlines you've seen in the news over the past year. They're all pretty positive, right? The stock market has set record highs, unemployment has hit its lowest point in nearly 50 years, and wages have finally started to rise across the pay spectrum. But these rosy headlines obscure the reality that millions of Americans face in their daily financial lives. In fact, at our 2019 Pulse survey, we found that only 29% of people in America are financially healthy. So these are individuals whose daily systems help them build resilience and allow them to pursue opportunities over time. We also found from our 2019 research that more than half of the population, approximately 54% of Americans, are financially coping. So these are individuals who are struggling with some, but not all aspects of their financial lives. And we found that a sizable minority, 17% of the population, is financially vulnerable. These are individuals who are struggling with most, if not all, aspects of their financial health. And these findings are telling because they show that despite an economy that has continued to grow over the past year, millions of Americans are still struggling financially. And collectively, these findings suggest that we need to be looking beyond the headlines to assess the true nature of people's financial lives, which is really what the U.S. Financial Health Pulse is designed to do. So in just a moment, I'm going to unpack some of those numbers, share additional data and insights from the 2019 Trends Report with all of you. But first, I'd like to tell you a little bit about the U.S. Financial Health Pulse Research Initiative itself. The U.S. Financial Health Pulse is a groundbreaking research initiative designed to track the financial health of Americans over time. Using a combination of nationally representative consumer surveys and transactional data, we plan to release ongoing data, insights, and benchmarks about Americans' financial health and how it's changing over time. To collect survey data, we're partnering with the University of Southern California to field annual ongoing surveys to their nationally representative online panel. The surveys employ a cross-sectional and a longitudinal design, which I'll tell you a little bit more about in a moment, which allows us to draw insights about how financial health is changing for the nation as a whole, as well as for individuals. To collect the transactional data, we've established a partnership with the data aggregator Plaid. And so using Plaid's back-end API and a user interface designed by the USC team, we've been inviting the survey respondents, those individuals who have responded to the 2018 and 2019 consumer surveys, to consent to share their transactional records with us. So we're asking them to consent to participate in the survey, to link their accounts their mortgages, their 401ks, their checking accounts, their savings accounts, etc., giving us as researchers really unprecedented insight into how these individuals are spending, saving, borrowing, and planning. Beginning later this year, in just a few months, we'll begin to be speaking publicly about what we're seeing in this unique data set. But for the time being, for the remainder of this webinar, I'll be focusing on findings from the survey data. I am, however, happy to answer any additional questions you have about this data collection during the Q&A portion of the webinar. So I just said this, but it bears repeating. The 2019 Trends Report is solely based on survey data, so we'll be focusing exclusively on survey data for the remainder of this webinar. The survey on which the 2019 Trends Report was based was fielded to members of USC's online panel, which is weighted to be nationally representative. The survey was in the field from April to June of 2019, which is the same period in which the 2018 survey was fielded, allowing us to compare responses from like periods in the field. Respondents could choose to take the survey in English or Spanish. The average length of the survey was about 24 minutes, so we were able to ask our 8 indicators of financial health questions, plus more than 100 other questions, all about respondents' financial lives. Of the approximately 7,000 members of the USC's panel who were invited to take the survey, approximately 5,400 responded to the survey in 2019, serving as our total sample size, just over 5,400 for the 2019 Trends survey. 4,300 of these individuals also responded to the 2018 baseline survey. These numbers are highlighted at the chart at the bottom of slide 10. So these 4,300 individuals comprise our longitudinal sample that we can use to track changes in financial health over time. And the way that the survey is designed, this unique methodology, allows us to conduct analysis at multiple levels. So in the report, we use the cross-sectional sample, those 5,400 people, the total sample size, to explore financial health trends at the national level, across financial health indicators, and at the level of demographics. We then use the longitudinal sample, those 4,300 individuals, to explore year-over-year changes in financial health for individuals. I should say that both of these samples are weighted to be nationally representative, and unless otherwise noted, all of the results that I highlight in this webinar and that we highlight in the report, they're statistically significant at the 95% confidence level. A few final slides on methodology before I turn to the findings themselves. So throughout this webinar and throughout the report, I'll be using the definition of financial health as our basic measurement framework. Financial health comes about when your daily systems help you build resilience and pursue opportunities. So unlike narrow metrics like credit scores or these overly abstract figures that I shared in the beginning of the webinar, things like the national savings rate or GDP or even unemployment, financial health is a nuanced metric that assesses the totality of an individual's financial life. And in order to measure financial health, we at the Financial Health Network have developed a set of 8 indicators that collectively shed light on a person's financial health. So an individual is financially healthy if they spend less than their income, they pay all their bills on time, they have sufficient short and long-term savings, they have a manageable debt load, a prime credit score, appropriate and adequate insurance, and they're able to plan ahead financially. We've also gone a step further with developing this framework, and we've developed a scoring framework to layer on top of these 8 indicators. So for every respondent who answered 8 survey questions that align with these 8 indicators of financial health, we can calculate 1 financial health score and 1 subscore that align with the 4 subcomponents of financial health: spend, save, borrow, and plan. Financial health scores are based on a scale of 0 to 100. And financial health scores and subscores between 0 and 39, these scores belonging to these individuals are considered financially vulnerable. So these are individuals who are struggling across most, if not all, of the indicators of financial health. Financial health scores and subscores between 40 and 79 are considered financially coping. Individuals with these scores are struggling with some, but not necessarily all, aspects of their financial health. And financial health scores and subscores between 80 and 100 are considered financially healthy. So these are individuals who are spending, saving, borrowing, and planning in ways that allow them to be resilient and to pursue opportunities over time. So to learn more about the financial health score, I'd encourage you to visit the website on this screen. I think many of you have likely heard us present on this framework before, so I won't go any deeper here. But for those of whom, for you, this is new, please do take a look to learn more about our measurement framework via the URL on the bottom of this slide. So without further ado, let me turn to what you all called in to hear about, the key findings from the 2019 Trends Report. And starting at that very highest level of analysis, at the level of the national trends that we saw, we find that despite a booming economy, less than 1 in 3 Americans are financially healthy. These are going back to the headline figures that I showed you at the beginning of the presentation. We find that 29% of individuals are financially healthy, just over half of Americans are financially coping, and a sizable minority, 17%, are financially vulnerable. And these figures are not statistically different than last year, when we found that 28% of Americans were financially healthy. They're indeed within the margin of error there. But they're telling because they show that millions of Americans are still struggling financially despite an economy that appears as if it has continued to grow over the past year. However, these aggregate figures only tell us so much. So to truly understand the financial health of people in America, we need to dig deeper. We need to disaggregate the data. And when we do, we actually see a lot of movement. We find very significant changes in financial health at those other levels of analysis that I shared previously. And some of these changes are positive. So for example, we see that Americans are having an easier time paying their bills, and they are more confident about their ability to pay off their debt. Starting with that first indicator, we see that 2/3 of Americans in 2019 say that they can pay all of their bills on time. This is an increase of approximately 2.2 percentage points from last year. And in the report, we hypothesize that this may be the result of full employment and wages that have finally started to rise, especially for those at the lower end of the economic spectrum. We also find that 6 in 10 Americans say they expect that they will have paid off their existing debt, this is non-mortgage debt, within 5 years. Interestingly, though, this increased optimism has not coincided with a reduction in self-reported debt. In fact, we find in our data that total household debt actually increased marginally during the study period. So we hypothesize that this increased optimism may be the result of high consumer confidence due to a surging stock market, high home values, and low unemployment, rather than an actual reduction in overall debt loads. But as we continue to explore the data, we also see signs that many Americans are becoming increasingly financially vulnerable. For example, we see that people are setting aside less money in short-term savings, and they're less confident their insurance coverage will be sufficient in the event of an emergency. So beginning on the left side of the screen, we see that 12% of Americans say they have less than 1 week of living expenses, which is an increase of 1.4 percentage points from 2018. And while a reduction in liquid savings may not be surprising to see during economic boom times, we still find it concerning because it means that millions of Americans don't have a cushion to turn to in the event of an eventual economic downturn. Likewise, we find that 58.2% of Americans say they are confident their insurance will provide sufficient coverage in an emergency. This is a decrease of 3.2 percentage points from 2018. It's one of the largest decreases that we saw in these aggregate statistics in our data set from last year. And we see that this decrease actually did coincide with a decrease in self-reported rates of multiple types of insurance ownership nationally. This is corroborated by other external data sources as well as ours, particularly around health insurance, which some of these external sources attribute to political efforts to undermine the Affordable Care Act. From these national statistics, we disaggregate the data further. And when we do, we find that financial health disparities based on age, gender, income, and race have persisted since 2018, with some groups actually showing signs of increased vulnerability. But first, the good news. We find that people with low incomes, in the study defined as household incomes of less than $30,000 a year, have made some financial gains in the past year. So we see that far more individuals in this income segment report spending less than their income in 2019 than they did in 2018. We also see that a greater share of individuals in this income segment are able to pay all of their bills on time. And we see that a greater share say that they have a manageable amount of debt. And as with the positive changes we see in this regard at the national level, we hypothesize that these findings are due to low unemployment rates and the fact that real hourly wages have finally started to increase across the economic spectrum. However, it's important to keep in mind that individuals in this income segment, again, these are low-income individuals defined in the study as those making less than $30,000 a year. These individuals are far less likely to be financially healthy than their higher-income peers. Continuing to explore trends in financial health by demographics, we find that some groups are showing signs of increasing vulnerability. So the first group that we look at in the study is middle-income earners, defined in this study as those making between $30,000 and approximately $99,000 a year. These individuals are showing signs of increasing vulnerability across multiple indicators of financial health. A few are depicted on this slide, and they include indicators around spending, around confidence in long-term savings, and confidence in insurance coverage. Likewise, we see that the proportion of people in their prime working years, that these individuals are also starting to show signs of increasing vulnerability. So in this study, we define those in their prime working years as being between the ages of 26 and 49. These individuals are indeed showing signs of increased vulnerability across many of the same but not identical indicators of financial health, their confidence in insurance coverage, their confidence in short-term savings, and the manageability of their debt. Again, on this slide and the previous slide, we're depicting signs of increasing vulnerability. So these upward trends suggest something to pay attention to. And the signs are particularly concerning given the economic high watermark that we're currently enjoying. And they suggest that these individuals and their families may be most vulnerable in the event of an upcoming recession. We also look at financial health trends by gender, and we find another group showing signs of increased vulnerability is women, particularly in relation to men. So we find that the share of women saying that they do not have enough savings to cover 3 months of living expenses increased to approximately 51% in 2019 from 2018. Likewise, the share of women reporting that they are not confident about their long-term savings increased to nearly 68% of the population in 2019. And finally, the share of women who say they are not confident their insurance will provide sufficient coverage in emergency jumped 6 percentage points to nearly half of the population in 2019. Meanwhile, the share of men reporting these signs of increased vulnerability either stayed the same, as you can see from the trends on the graph, or actually decreased in the case of the confidence of long-term savings, that graph in the middle, showing that the financial health gap between men and women may be widening. Of course, with only 2 years worth of data, we can't tell whether these findings are a temporary blip or a long-term trend, but there will be something to watch in the coming years, something that we at the Financial Health Network in particular will be paying attention to. And the final group, the final demographics that we explore financial health trends by is race and ethnicity. In this report, we look only at white, Black, and Hispanic respondents because these are the only groups in our sample large enough to provide statistically significant comparisons. And we don't actually find any significant changes in the financial health of these groups over the course of the last year, from 2018 to 2019. So in the absence of these changes in trends, in the report, we actually take a step back and we begin to explore a financial health gap that persists across these groups, across nearly all of the 8 indicators of financial health. And you can see a selection of those indicators. You can see all 8 of the indicators, I should say, displayed on this screen. In the report, the analysis is fairly short, it's fairly targeted, and it's somewhat preliminary, but it lays the groundwork for additional research that we at the Financial Health Network plan to publish on financial health disparities across race and ethnicity later this year. And with that, we arrive at the 4th and the last level of analysis that we conduct in the 2019 Trends Report. We look at the financial health of individuals, how it changed for the very same individuals over the course of the year. And we see that despite relatively stable headline statistics, so everything that I just shared with you, some of the points changed, but many of the changes were just a few percentage points here and there. So despite these relatively stable headline statistics, we see a lot of movement in financial health at this 4th and final level of analysis, at the level of individuals. Looking at the data, we find that nearly a quarter of people in our sample changed financial health tiers over the course of a year. So that's approximately 24% of the sample who moved from one financial health tier to another since 2018, and you can see from the diagram on this slide that they moved in all directions. So approximately 6% of the sample moved from healthy to coping, while 7% moved down from coping to healthy. Likewise, we see that 6% of the sample also moved from coping to vulnerable, while another 6% moved from vulnerable to coping. And as you'll see in just a moment, these numbers are roughly equivalent because changes in our financial health score were normally distributed. But lest you think that these numbers characterize just individuals who are moving from the cusp of one segment to the cusp of another, on the next slide, you can actually see the distribution in financial health score changes itself. And we see in the data that approximately 50% of respondents saw their financial health scores increase or decrease by 7.5 points over the course of the study period. So 7.5 points is the median financial health score change since last year. And while our framework doesn't allow for easy generalizations because it's often nuanced, you can roughly think of a 7.5 point change as an increase or decrease in at least 2 of the indicators of financial health. So for example, that would be an individual moving from paying all of their bills on time in 2018 to paying most of their bills on time in 2019. Likewise, this individual could have moved from having a manageable amount of debt in 2018 to having a little more debt than is manageable in 2019. That would roughly, for example, be a 7.5 point change in financial health scores over the course of a year. But of course, as you can see on this slide, many people experience changes in their financial health scores far greater than 7.5 points. So roughly 20% of our sample saw their financial health scores increase or decrease by more than 15 points, which roughly corresponds with a change in at least 4 of the indicators of financial health. And roughly 11% of the sample experienced a change in their financial health scores of more than 20 points, roughly corresponding with a change across most of the 8 indicators, or I should say multiple changes within indicator levels. Moving on, and then I'll turn to questions in just a moment. We also saw that people who experienced certain life events generally saw larger year-over-year shifts in their financial health than those who did not experience those life events. So in general, the largest year-over-year changes that we saw were those changes related to employment. And you can see a couple of variables related to employment on this slide. Starting off at the top, we saw that the largest association had to do with those who started working in 2019, but did not, those who started working in 2019 and indeed were not working in 2018, compared to those who did not start working in 2019. So this latter group, the group of comparison, would be those who were working in 2018 and continued to work in 2019, or those whose working status indeed did not change. So again, sticking on this thing with this top variable, we see that people who were not working in 2018 but started working in 2019, their financial health scores increased an average of 7.9 points more than people whose working status did not change in 2019. And you can see similar associations, somewhat smaller, but still significant for the other variables on this page. Income became more predictable, income became less volatile, and those who received a promotion or a raise. I often get asked questions around how we're defining income predictability and volatility, so let me take a moment to explain that. In the survey, we ask a question around income predictability that says, how many months over the course of the past 12 months would you say that you could predict your income for the next month? The volatility question approaches a related subject, a related topic, but is worded somewhat differently. In that question, we ask, to what extent did your income change every month over the past year? So again, related, but slightly different concepts there. We also saw that individuals who experienced changes in their physical health also saw large average year-over-year changes in their financial health. So starting with the top example, we saw that individuals whose financial health improved in 2019 from 2018, these individuals experienced an average financial health score increase of 1.8 points more than those whose physical health did not improve. Likewise, you can see the correlation is actually negative in this case for those who experienced a major medical expense and those whose physical health declined since 2018. Similar size correlations with greater decreases in this case in financial health scores than those who did not experience these negative life events related to their physical health. In the report, we also discuss additional life events, and you're welcome to flip through those pages, but we highlight physical health and employment as being the two life events and factors that are most highly correlated with these year-over-year shifts in financial health at the level of individuals. Moving on to our final series of findings, we explore the role that debt and savings can play in either blunting the positive effects of some life events or mitigating the negative effects of others. And we see in our data that having debt can actually hinder the positive effects of some life events. So returning to this variable of started working, we look at people who started working in 2019 but were not working in 2018, and we see that for these individuals who have low debt, defined in this study as less than $22,000, this is excluding mortgages, we see that their financial health scores increased by an average of 11.6 points. However, for those who started working in 2019, who had high debt, again defined as more than $22,000, their scores increased only an average of 1.4 points. And you can see similarly sized, again, but slightly smaller correlations for some of these other variables. Some of the smaller changes we see on this slide are not statistically significant within that 95% confidence level, but I would say that the pattern still holds. The trends are clear that having debt can blunt some of the positive effects of some of these life events. And last but not least, we look at the role of savings. And we indeed find that savings can mitigate the negative effects of other life events. So the opposite is true, essentially. In our longitudinal sample, we find that those who experienced a major medical expense over the course of the study period experienced an average decrease in their financial health scores of approximately 2.8 points. However, this average decrease in financial health scores was much larger for those with low savings than those with high savings. So in this study, you can see the relative magnitude of the savings displayed across the page. For example, people with less than $300 in liquid savings experience an average decrease in their financial health scores of 8.9 points, compared with people who have more than $14,000 in liquid savings. Again, this is all self-reported data. These individuals actually saw an increase in their financial health scores, a slight increase. That last increase, not statistically significant, but again, the pattern holds here as well. And I think what's particularly exciting about these last series of findings is that they show that a person's financial health is not static. but rather it's dynamic, it's fluid. It's something that can change dramatically over the course of the year. And I would say from where we sit at the Financial Health Network, this is promising for us and for the stakeholders that we work with, because it reinforces the need for many entities, not just financial service providers, but many other stakeholders across the financial health ecosystem to improve the financial health of Americans. It shows because financial health is not immutable, because it's not fixed. It means that we as stakeholders can do something to make a meaningful difference in the financial lives of millions of Americans. In the report, we outline clear next steps that these stakeholders and others should take to ensure that people have access to the tools they need to manage their day-to-day finances, build resilience, and thrive. But I think I'll pause here. I shared a lot of data. I've just done a lot of talking at this point. I think I'll pause here and turn to questions from the audience. Again, you are welcome to submit your questions via the panel at the right side of the screen. Please do keep them coming. We have a couple questions that we've received so far. We have one question about whether we have correlated our financial health scores to the CFPB's financial well-being scores. Are we competing with that score, the question asks. And they talk about the skews in our score compared to the CFPB's measure. So happy to start with that one. Indeed, we have done a lot of thinking as well as a lot of analyzing of how our financial health score compares to the CFPB's. In fact, in our 2 consumer surveys, we have fielded the shortened version of the CFPB's, the 5-question version of their financial health score for the last 2 years. So not only have we done some initial point-in-time analyses that I'll tell you about in a moment, we actually also have longitudinal data on how the CFPB scores move alongside ours. Going back to the point-in-time analysis, we did indeed correlate our measure with theirs. We did this analysis about a year ago on the 2018 survey data. And we find that our scores are very well, they correlate very nicely with the CFPB's. Their score is normally distributed. Our score does indeed skew a little bit towards the left-hand side of the graph, and that was an intentional design choice on our part. We wanted our financial health score to be more reflective of changes at the lower end of the economic spectrum. So the skews are a little different between ours and theirs, but when we do additional analysis, and I should point out to the person who asked this question that all of this analysis I'm describing is detailed in the appendix of last year's report, the 2018 report. Again, when we do that analysis, overall, we do find that our scores are quite nicely correlated, quite highly correlated with the CFPB's. I will say that they are not exact, and that is intentional because we, with our definition of financial health, are striving to measure something that's a little bit different than what the CFPB is striving to measure with theirs. Our definition of financial health is very actionable. It was originally designed purely for financial service providers. We share our results back in the form of the spend, save, and borrow and plan framework that I've highlighted. The CFPB designed their score to measure what I like to think of as a somewhat higher order of wellness. Financial wellness is a little bit less day-to-day, a little less tactical than financial health, and they designed their score specifically for financial coaches to use. So when the person asks whether we're competing with the CFPB, I actually think that our work is very complementary to theirs. We designed it for a slightly different purpose, to measure a slightly different concept for a slightly different audience. But for the end user, I would highly encourage you to use either our research methodology and instrument or theirs. We are fairly agnostic. We think that each serves a different and a valuable purpose. Thank you for that question. Please do keep the other questions coming. There's one question here about what some of the most surprising or unexpected findings from the 2019 report were. It's an interesting question, and we spent a lot of time thinking about what we might expect to see in the data when we began this analysis. And I would say, in many respects, our hypotheses held true, in that we expected to see fewer shifts in the data at that aggregate level, and we expected to see greater shifts in the data when we turn to the longitudinal sample, when we see the year-over-year shifts in financial health for individuals. And indeed, we found that to be the case. So as I said just a few moments ago at the start of the webinar, the change in the financial health at that aggregate level from 28% financially healthy last year to 29% financially healthy this year, that actually was not a statistically significant change. But as you peel back the layers of the onion, if it were, as you dig deeper and continue to disaggregate the data, you see larger and larger shifts in financial health over the course of the year. And indeed, we find that the largest shifts happen at that level of the individuals. So I think it was indeed surprising to the research team here to see that approximately a quarter of our sample, that roughly 24% of individuals, changed financial health tiers over the course of the year. I don't think we expected to see findings that large. However, as I said, it is somewhat meaningful and somewhat heartening, because it means that financial health, much like some of the poverty studies that have been done, financial health, it does shift year over year. So I will say that that final portion of the analysis, there's a lot more that we as researchers can unpack here. And we'll continue to track that longitudinal data over time. For example, I often get asked the question, you talk about financial health changes being correlated, those who with employment and physical health, changes in that status from last year, but amongst the indicators of financial health, did you see any indicators of financial health changing at a greater pace than other indicators? And indeed, based on the 2 years worth of data that we have, we see that those who experience the largest overall changes in their financial health and financial health scores also in general saw the largest shifts in the indicators around the confidence in their insurance and the confidence in their long-term savings, their ability to be on track to meet their long-term goals. So whether those correlations remain with 3, 4, even 5 years worth of data is something that we certainly want to be able to explore. One other thing I'll add to that answer is something that we also want to explore moving forward, is whether the role of savings and debt, whether all of these changes that I've mentioned at the individual level, the extent to which they differ for different population segments. So do women experience the role of debt or savings differently than men, for example? We ran up against, in full disclosure, we ran up against small sample sizes in this year's work, but as we continue to expand upon the work, as we collect additional data, we hope to interrogate some of those questions as well. Thank you for all the questions. I'll try to get to as many of them as I can. If I am unable to answer all of them, because there are a fair amount, I'd be happy to answer them offline directly. There's a question here about the transactional data, the PLAD data that we've collected. The question is, how exactly do you use the data that you collect? Does it contribute to what category a person ends up in? So those are exactly the types of questions that we're wrestling with now. How to integrate findings from the transactional data analysis with the survey analysis that I presented. Because as I pointed out earlier, we do have a one-to-one match between those individuals who are sharing their financial transactional data with us and those who are responding to our surveys. So we plan to use that data set in a few ways. Our first objective with that work stream is indeed to tell some sort of a comprehensive composite story about financial health in America and how it's changing over time alongside the survey data. And one way to do that would be to try to use the transactional data to either reinforce or complicate or explain the survey data, which we are planning to do, so to look at the extent to which we can actually measure those 8 indicators of financial health in our transactional data. But the other way to think about it is that the 2 data sources they tell us different information for different reasons. And so instead of thinking of it being a one-directional, a unidirectional relationship, use the transactional data to reinforce the survey data, we need to think more bidirectionally. What can we learn about financial health leveraging these two distinct sources of data? So what individuals tell us about their financial health through survey data, and what we are seeing in the transactional data based on their financial records. So we're in the process now of constructing a series of new indicators that may or may not align with the existing 8 indicators that we can confidently and reliably measure from the data set, with the goal of, by the end of this year, releasing the insights from both of these data sets to tell this comprehensive story about financial health in America. At the same time, though, we're thinking about how we can make this analysis that we're doing, this measurement that we're doing, actionable for other financial service providers, fintech organizations, nonprofit organizations, direct service providers, so that they too can measure their financial health of their customers, clients, or employees using their own data. So we've been thinking about building a measurement framework analogous to the financial health score, but based on transactional records that we can make free, open source, just like the financial health score based on survey data, that other entities can use to measure their customers and clients and employees' financial health. That's work that we're considering doing at the moment as well. So 2 primary objectives: telling the story about financial health in America, and then making the framework actionable. But I do think that we are just beginning to, frankly, scratch the surface on the potential of this data to be using it on a regular, more ongoing basis. Perhaps we release quarterly insights to serve as more of a leading indicator of financial health in America. If we get our sample size to be large enough, we can also use it to start to assess, if not impacts, certainly correlations, let's say, of certain events, of natural disasters. Let's say if a hurricane were to hit the Southeast, do we see, based on our financial records, the financial health of America changing? So a lot more to think about there, a lot more to unpack there, but really an exciting avenue of analysis, of strategic thinking for us, because that is one of the attributes of this initiative that really makes it unique in the field. I see one question around collecting data from couples. I'm going to answer that in a slightly different way, but we often get asked the question around the unit of analysis, and to the extent that we are capturing a household's finances. So to that, I would answer that we think of in this study the unit of analysis as being the individual. So all of the percentages, the percentages and those raw figures are based on individual responses. However, whenever possible, we try to frame our questions at the household level to allow us to see the wider picture of an individual's financial life, because indeed that will be quite meaningful in understanding that individual's life. The couples, we do have that data. The USC data set is very wide and allows for additional analysis there. So if that's an area of interest to our audience member, we'd be happy to follow up and see how we can provide you with additional detail there. I have a question about whether the data allowed for the analysis of intersectionality of gender and race. For example, looking at measures for women of color compared to measures of white women. Indeed, we have the data. We do tend to run up against smaller sample sizes when we start to disaggregate by multiple demographics, but we know that that is such an important avenue of analysis that we are committed to pursuing that. In fact, one of my colleagues here at the Financial Health Network plans to do some analysis specifically looking at the financial lives of women of color compared to white women and others, likely producing those results in a blog post later this year. So that's another avenue that I can potentially follow up on with the question asker there. As I'll talk about in a moment, the 2019 trends report really is the tip of the iceberg in terms of the data analysis that we can do on our data set. We plan to do much more analysis through blogs, through briefs, over the course of the year, and so I would encourage you all to stay tuned. Likewise, I don't think I mentioned this yet, but I absolutely should. The data sets, everything that I've been discussing, the 2018 and 2019 data sets are all publicly available for download. So if you have any questions that I'm not addressing, and I apologize, there are so many great questions here, I simply don't have time for them all. But if there are any other avenues of analysis, I'd encourage you to follow up with me about them after the presentation, or better yet, download the data, explore it on your own. In addition to the data set, we have a nice data visualization tool that you all can play around with as well. And indeed, the recording of this webinar will be shared. I have a question around retirement readiness based on demographics. That's actually another topic that we'll be addressing in a blog post in about a month. So we'll be exploring the extent to which different generational cohorts, millennials, baby boomers, Gen X, etc., each group feels prepared for retirement based on their sentiments, as well as based on their self-reported long-term savings as well. I have a couple questions here around the designing of interventions, so specifically using insights from this analysis to design products, programs, services, solutions, interventions to improve financial health. And what I briefly skipped over, but that we do go into more detail about in the report, is this financial health ecosystem slide. So historically, for the last 10, 15 years or so, the Financial Health Network has really spoken directly to financial service providers. We've done a lot of work with these entities, banks, credit unions, fintechs, nonprofits, and others to help them think through how they use learnings like these and other learnings to design higher quality products and services that allow folks to spend, save, and plan for the future, as well as borrow responsibly. Unfortunately, I shouldn't say unfortunately, but I should say that the study methodology of the U.S. Financial Health Pulse makes it very hard to measure impact. Our study design is simply a little too zoomed out. It's designed to assess larger trends in financial health. But separate from this research, we are doing a lot of work at the Financial Health Network to test this idea of intervention. So again, to leverage findings such as, to take two examples, the importance of debt, the role of savings, and to work with other companies, mostly fintech providers, but we have some more established players as well, to design and test interventions to get a sense of whether these interventions are indeed having an impact on the financial lives of people. We often say, are they moving the needle on financial health? And so this is research being done in two ways, again, outside of this initiative. One is through the companies who are participating in our Financial Solutions Lab. We just relaunched. This is the incubator and accelerator that we've run for the last 5 years. We just relaunched the second phase of that work. And we have a large impact assessment component that I encourage you all to stay tuned for insights to come out of that work. And the other way that we're assessing impact of interventions is through the Financial Leaders Program. So these are leaders, these are the members of the Financial Health Network's membership who are testing interventions to see what moves the needle on financial health. We'll be releasing insights on the impact of those interventions later this year as well. So that's the financial service providers. And again, for the last 10 or 15 years, we've largely been focused there. But as we started to broaden the aperture when it comes to financial health, we've realized from this research and from others that we need to be speaking to a much wider group of stakeholders beyond just the traditional financial service providers. So certainly the policymakers and regulators who affect how policy is made at large in the United States, and then the regulators of the financial services sector, but as well employers. Employers play a large role in the financial health of employees. As you can see from some of the data that I shared in this presentation, around the extent to which the year-over-year changes in employment can have a dramatic impact on financial health. This is also an area that we've explored to some length in the 2018 report. There we found that in general, individuals who experienced greater volatility in the workplace in the form of wages, hours predictability, scheduling predictability, etc., that those individuals with greater volatility in the workplace also in general had lower financial health than others. So clearly there's a role for employers to play in improving the financial lives of their employees, and we're doing some work, a fair amount of work, I should say, in that arena as well. Educators, these are going to be the secondary, those who, colleges, community colleges and other colleges, that's where we focus most of our work to date, can think about how they use their own data, their own analytics, to assess early warning signals, if you will, for those who are becoming at risk of falling into financial ill health. The connection between education and financial health is quite clear there, and there's a lot of work that can be done and that we have been working with others to do over the last couple of years there. And last but not least, in the financial health ecosystem, we have healthcare providers. So another arena that the Financial Health Network has started to gradually wade into there. As we all know, healthcare bills are the largest form of outstanding medical bills, I should say, are the largest reason for bankruptcy in this country. So again, another clear connection between financial health and physical health here. And there's a lot of work that insurers, hospitals, primary care physicians, and others can do to be thinking holistically about the financial health needs of their patients as well as the physical health needs. I'm going to take one last question, and then I'm going to make a commitment to all of you. If I did not have a chance to address your question, I'd be happy to do so in writing after the webinar. The last question I'll take is the one around trends in geography. So that may reflect how policy changes in a given state or city may have contributed to improved financial health relative to other locales. That's a fantastic question. So I will say one of the limitations of our data set is that it's only based on 5,000 responses, plenty sufficient to be nationally representative, also representative at the level of geography, but that breaks down a little bit. The statistical significance breaks down when you start to go beyond, beneath the level of region. So unfortunately, the data is not statistically significant at the level of states or MSAs, metropolitan statistical areas, but that is a question that we get again and again. This data is fantastic, but it would be more meaningful to me if it was representative of my state or my city. How can we make that happen? So we've been exploring some creative ways to ensure that the data is indeed representative at some of those other levels. There could be some modeling work we could do if we enable our transactional data set to be large enough, then certainly we could, and we find a way to ensure that we have the geographical markers appended to that data. We can certainly think about doing this sort of assessment at the level of states and municipalities. Again, we'll need to be careful about over-imputing causation here, but I think what the question asker is alluding to is, are there natural experiments that might naturally occur in the data set before and after if a new policy is introduced and rolled out? So certainly something that I think is a goal of this study that we are striving towards, something that may not happen for another year or two, but something that we're committed to exploring as we move forward and continue this work, because we know how powerful those insights are at the level of the states and the municipalities. So with that, I would like to thank you all for your engagement, for your participation, for these fantastic questions, and I'd like to leave you with a few concrete ways that all of you can continue this conversation and continue to engage in this data. And first and foremost, I'd encourage you, if you have not already, to download the 2019 Trends Report and to read the report. Again, I skimmed the surface on the wealth of insights and actionable recommendations that we profile in that report. That report can be found on our website, finhealthnetwork.org/pulse. I'd also encourage you to explore the data. So there are two ways that you can do this. there is a fantastic data visualization tool on that website that I've just highlighted, where you can actually play around with the data. You can cut it based on some of these demographics that we've been talking about. So that person who asked about the women of color, that's absolutely an analysis that you can do using this easy-to-use data visualization tool on our website. That's on that main page. But then for those of you who are data analysts, who lead teams of data analysts, who have access to data analysts, I'd encourage you to download the entire data set. You can choose the 2019 data set or the 2018 data set, and you can run your own exploration and analysis of some of these trends in financial health. We really think of the Pulse as a public good available for all of you to use and to explore. So indeed, the data is available. If you have any questions, you're welcome to contact me, and I'll make sure you get the analytical support that you're looking for. I'll leave you with my contact information in just a moment. I'd also encourage you, beyond looking at the 2019 Trends Report, to explore some of the other reports that we've written based on the Pulse data set. So the one report that's out now is the Redesigning the Financial Health Roadmap for Low and Moderate Income Americans over the age of 50. It's a really, really nicely done report that takes some of these more general learnings and applies them to low to moderate income individuals over the age of 50. Not yet out, but it will be released in a matter of weeks, is a financial health pulse that we conducted for the state of Hawaii. So that's another way in which I would answer the gentleman's question about the geographic distribution of our data, in that the framework that while the data set that we have is not representative at the state level, the framework is easily transferable to other contexts. So here we've worked with a number of local stakeholders in Hawaii, a couple local foundations, the Bank of Hawaii, to field this study, to conduct original research in the state of Hawaii, and to use our financial health framework to measure the financial health of people in Hawaii, comparing it to national benchmarks. So again, I'd encourage you all to skim this report, even if you may not be interested in Hawaii itself, though then again, who isn't? You can think of this Hawaii report as a really nice template for how we might go about, or how you all might go about collecting insights at the state or the city level. I'd also encourage those of you who work directly with customers, with clients, with employees, with communities, to check out our Financial Health Score Toolkit, available at the URL at the bottom of this page. We have designed this framework to be a very easy-to-use toolkit that other entities can use to diagnose, to measure, to track the financial health of the individuals that you work with. We've also supplied national benchmarks that come from the U.S. Financial Health Pulse, so you can compare the results of your customer or client base with the national benchmarks. You can also share financial health scores back with the individuals that you serve, or you can use them purely for assessment for diagnostic purposes on the back end. Last but not least, I'd like to leave you with the 3 final ways that all of you can continue to engage in this exciting research. As I said, please do explore the data set. For those of you who are funders, if you're interested in sponsoring a separate report, whether it be a topic or a segment deep dive, please do. And last but not least, you're welcome to request proprietary cuts of the data. So with that, I'll skip the emerge slide, and I'll leave you with my email address. Please do reach out, and I look forward to continuing the conversation with all of you. Thanks so much. Bye-bye.